Good afternoon. Hey, I'm Dr. Bill Christenberry at Caldwell Mill Animal Clinic, and a question we get asked a lot around here is about their pet's thyroid gland. And the thyroid is a gland. As I said, it is in the neck of the pet, just like it is in yours and mine. We have a thyroid gland too that's in the neck, and that's where the dog's thyroid gland resides, and the cat's too. And when dogs get older, a lot of times their thyroid function diminishes. They don't have as much production of the hormone, of the thyroid hormone that the thyroid normally produces. And in general, what the thyroid hormone does is helps control metabolism. It stimulates and it increases or keeps the metabolism elevated where it needs to be. And so therefore, if your dog has a diminished thyroid hormone production, then they get more lethargic. The main signs are that lethargy. They'll gain weight because their metabolism is lower. Their hair coat will get poor. A lot of times they will be cold. One of the things that the symptoms that's described for hypothyroidism is heat seeking, especially in the winter. Your dog looks for the heating vent and lays on top of that, just trying to get warm because they're colder, because their metabolism's lower, and so they just tend to run a lower body temperature. So that's what it's called. I mentioned hypothyroidism. Hypo means less or lower. And that's what happens with dogs with hypothyroidism as they get older. And we can supplement that with a thyroid hormone that's given twice a day, and that will help give back some of what the thyroid produces and give them a little bit more vitality in life as they get older. And we check that through a blood test. A blood test will measure the thyroid hormone level in the bloodstream and can tell us if that's low or not. Now, interesting thing, cats can have problems with their thyroids as well, but sorry about that. Paging. I'm going to turn that off. All right, back to our story. Cats, as they get older, also can have thyroid issues, but cats normally, well, not normally because it's not a normal issue, but if they have a problem with their thyroid, it is usually hyperthyroidism. And just as hypothyroidism means lower or less, hyper means more or too much. Hyper, like we talk about kids that are hyperactive, they're too active. Hyperthyroidism. And what happens with cats with hyperthyroidism is they'll actually get a benign little tumor in their thyroid gland that's in their neck. And a lot of times you can feel it, or we can feel it, and that's one of the things we do on a geriatric cat when we're doing an exam on them. We'll actually palpate their neck. We do what we call trying to slip the gland, because you can run your finger down and you can feel it pop under your finger when it's enlarged. And what it does is it produces too much thyroid hormone. And you can imagine, because of what I said that happens with the dog with too little thyroid hormone, what happens with a cat with too much. It makes them more active. They're a little bit more hyper. They usually have a ravenous appetite. They lose weight. They can't keep weight on, even though they're eating a lot. Their heart rate is higher. Just overall, their metabolism, everything's running faster. And so even though the tumor that causes this is benign, if it's left unchecked, they just continue to lose weight until things will start to shut down. And so that's one of the things, again, we check on a blood test on geriatric cats. And people also, even if they don't bring them in for their regular checkups, they'll notice that they're losing weight, and they'll bring them in for us to check that out, and we can find that out with a blood test. That can be treated in several ways. I mentioned with a dog, it's replacing thyroid hormone. With cats, there's a medication called methimazole that can be given that will suppress the thyroid hormone and suppress the production of thyroid hormone. It involves giving your cat a tablet, usually twice a day, for the rest of its life, because it is a suppressant. It suppresses the hormone. It doesn't cure the disease. So that's a thing. Sometimes cats can be difficult to give a tablet to. You can actually surgically remove the affected thyroid gland, and they're several things with that need to be considered with the cat's age, the surgery, complications that can happen due to the surgery, the parathormone gland or parathyroid gland that produces parathormone. And then radioactive iodine as a treatment that can be given that will basically, the radioactive iodine is injected and destroys the thyroid gland. And a lot of times if you do that, sometimes you have to supplement with thyroid hormones, so you're still end up giving a pill. So several ways to treat that, and we like to talk with our clients about how to treat that and what their preference is for that. So anyway, that's a thyroid gland just in a overall view in dogs and cats. So if you have any questions for us about that, if you think your pet may have a problem with their thyroid gland, we'd love to talk with you and check them out. So let us know, and we'll talk to you next time. Thank you for listening.